Welcome back to the Padma Show. This is Padma here with you with yet another interesting segment. In the first segment, we saw healthy cooking, healthy living, and now we are here at the Tumbe Hospital, Dubai, with Dr. Chandrakant Patil, who is an ENT specialist. I am sure all of you at home have a lot of questions on cough, fever, sinus, a lot of things, and here he is going to explain to us everything about sinus, sinusitis, and something called as fes. Dr. Chandrakant Patil has 20 years of experience as an ENT specialist with 20 publications under his name. What more could be a better person to explain to us about the whole thing? Welcome, Doctor, to our show. It's great to have you here.
Thank you, ma'am.
And we got to know that you're a specialist in ENT.
Yes.
And the most common question that arises in everybody's mind and people who talk about often is something called as sinus.
Yes.
Right?
Yeah.
बच्चों से लेके बड़ों तक कुछ भी होता है, लाइक कोल्ड है, फीवर है, हेडेक है, पहली बात जो उनके मन में आता है शायद ये साइनस हो सकता है.
Yes.
If you could let us know that, is this a myth or is it like something really related to sinus?
Sinuses are nothing but they are the empty spaces inside your facial bones,
Okay.
which are lined by a covering called as mucosal covering, and it is well connected to the nasal cavity. That's why it is aptly called as paranasal sinuses.
Okay.
That means around the nose you have empty spaces inside the facial bones which are called as paranasal sinuses. And since they are connected to the nose, any nasal infection is going to get into the sinus and it causes sinusitis.
Okay.
So yes, whenever you get cold, there are chances that you might get sinusitis.
And एक और बात which generally goes under the contention कि एक बार you are diagnosed with sinus, पूरी जिंदगी आपको वापस आता रहता है. Is that also like something a myth or is that like true? Because I know a lot of people they say like अरे यार मैं बाल बढ़ा नहीं सकती क्योंकि मुझे sinus आ जाता है.
So before answering your question, I just like to explain you what is sinusitis, and then I will answer your question. Sinusitis is a sinus infection. It can be acute or chronic.
Okay.
So what do you mean by acute infection? Acute infection means when the infection lasts less than 4 weeks, it is acute infection.
Okay.
But when the infection lasts more than 12 weeks, it becomes chronic. So if the infection is lasting for more than 12 weeks and it is happening recurrent, it is a chronic sinusitis.
Okay.
So I am partly answering your question that once you get sinus, you might hold it for lifelong.
Okay.
If the cause of sinusitis is like that, it is said now that the most common cause for the acute sinusitis is common cold, but for chronic sinusitis the most common cause is allergic rhinitis.
Okay.
And allergy is an immunological response given by the body. So once the patient is having allergy, it is a lifelong phenomenon. So if you are having allergy, you might have the predisposing factor for the sinusitis, and you might have the recurrent sinus infection for lifelong if you are not treated the allergic rhinitis.
If you're not allergic. Now what happens, like is this going to be affected the immune system also? Because allergy has to be treated.
Yeah, definitely.
Right?
Yeah.
So let's say like if the antibiotic is stopped and then the sinus recurring is going to be more frequent. Are we talking something like that?
Yeah, definitely. See, first of all, I should clear that antibiotic is not the solution for each and every sinusitis. That's why you must evaluate yourself. If you are having the recurrent symptoms of a cold, recurrent symptoms of running nose, or itching of the nose, or itching in the back of the throat, or if you are having a post-nasal drip, that means you are feeling that something is coming from your nose. These are the symptoms of the sinusitis. Or if you are feeling the pressure inside your face, or headache, recurrent headache, all these goes toward the sinusitis, might be the chronic sinusitis.
Okay.
And in which condition allergy might be the important factor which is predisposing the chronic sinusitis. So as allergy is related to the immunological condition, that means it is the immune response of your body, it must be treated by different medicines than the antibiotic.
Okay.
In short, as you said, antibiotic is not the solution for the all sinus infection. It should be properly diagnosed and treated well before you go for the treatment.
So tell me, doctor, if suppose a patient is coming to you and you identify this person has sinus or sinusitis, what would be the mode of treatment? Like what the patient has to do, or what the hospital will guide the patient?
Definitely. First, before going for the treatment of sinusitis, one must have the proper diagnosis or diagnosis by the ENT person. So the patient should approach to the doctor, especially the ENT specialist, to get diagnosed whether he is suffering from this sinusitis or it is else, because most of the symptoms of common cold, they overlap with the symptoms of acute sinusitis.
I'll have to actually ask you a question here, doctor. Like, suppose if I'm having cough, cold or fever, or any other person is having, the first doctor that we approach is a GP.
Yeah.
At what stage will I know that I should not be approaching the GP, but I should be going to an ENT specialist?
Yeah, definitely. There is a phenomenon called as watchful waiting.
Okay.
Every common cold, mostly which is a viral etiology, will be responded by your body's immunity, and it will be cured of its own with minimal treatment. That is, we call it as symptomatic treatment. That is called as watchful waiting.
Okay.
If the patient's symptom persists more than that, and that period is usually 7 to 10 days.
Okay.
So if the symptoms persist, or if the severity of the symptoms increases, or if there are other added symptoms like purulent discharge from the nose or back of the nose, or headache or nasal blockage, then we should suspect that you got sinusitis, and then you should approach to the ENT.
That was a very important information, doctor. Thank you so much for sharing with us. And is there any age criteria, like जब ये sinus आएगा, like बच्चों के भी आ सकता है?
Yes, yes.
And like even a newborn or like...
Definitely. Sinusitis can happen at all ages. Okay, because they are near to the nasal cavity. Whenever you get nose infection or whenever you get common cold, you are prone to develop the sinusitis. That's why in newer terms it is called as rhinosinusitis. So whenever you are having cold, you are prone for the sinus infection. So even the neonates, even the infants, that is newborn babies, they can catch cold. So they can have sinus infection.
And Tumbe Hospital, Dubai, you being the specialist.
Thank you.
You take care of infants also.
Yeah, definitely.
How does your treatment vary from an infant to a elderly person?
Definitely. In children's, we treat the common cold or nasal infection as early as possible, so that they should not go to the level of sinus infection, because antibiotics at that age group for a long duration, because when the infection goes in a sinus, you have to take the antibiotic if it is purulent sinusitis. So antibiotic at the early age is not good for children. So early diagnosis and prompt treatment is the key in the neonates and infant. As far as adults are concerned, the treatment varies depending upon the type of sinusitis, whether it is acute or chronic is, and depending upon the findings in the various tests.
Let's assume a child has sinusitis.
Yeah.
Okay, but the parents are not aware of this. क्योंकि हमेशा क्या होता है कि cold है, flu है, एक दवा लाके दो. After 2-3 days, the child cures, and then they go back to normal life.
Yes.
Right? Now, what stage is like if the parent can recognize that this guy or the child has sinusitis and that they have to reach to the doctor, right? Because not all colds come for 7 days.
Yes.
3 दिन आते हैं, 2 days are okay. Again they come back after 2 or 3 days.
Yes.
And 90% of them they are treated for common cold.
Yes. See, in children, the symptomatology differs from the adult. If the child is having recurrent cough or fever or post-nasal drip or nose block, we should suspect that he is having sinusitis. Okay. In children, the important predisposing factor or the cause that causes the sinusitis are the adenoids or the tonsils. Okay. These are the lymphoid tissue inside the oral cavity and nasopharynx. So we have to rule out that also, whether the child is having adenoid or tonsillar hypertrophy, which can predispose the recurrent sinusitis. So in that, patient needs to be evaluated, or children needs to be evaluated by the ENT, that they will look for the adenoids or they will look for the tonsils. And if that is the factor, we need to treat that. Otherwise, patient will have recurrent sinus infection.
Basically, then we will tell the audience that like, अगर आपके बच्चे को like cold or fever is there, recurrent, and it's coming with very short intervals, then you really need to go and meet the ENT at the earliest.
Because not only sinusitis, they need to rule out for the presence of adenoids and tonsils, which is important cause for the ear, nose, throat infection in the children. Not only sinus, ear infection also, recurrent ear infection is also the source from the tonsils and adenoids. So that needs to be ruled out, and that will be ruled out by the ENT, definitely. And
also, doctor, we've heard something called FES.
Yeah.
If you could enlighten our audience about this.
Yeah, FES is nothing but is a short form of functional endoscopic sinus surgery. which is the important treatment modality for the recurrent sinusitis or the chronic sinusitis.
Okay.
It is endoscopic surgery of the sinuses. This is a recent invention, and with the invention of this FESS, functional endoscopic sinus surgery, the old traditional surgical treatment which used to done over the face by ugly scar, that is not there now. This is minimal invasive surgery. That means we are doing the surgery of sinus from inside the nose with the help of endoscope.
Okay.
So it is a minimal invasive surgery without damaging your face. One important thing. And secondly, as you are seeing through the endoscope directly inside the sinus, the clearance of the disease with less or minimal complication is the key of endoscopic sinus surgery. So we are a team of Tumbe Hospital, Dubai. We are doing endoscopic sinus surgery regularly here and successfully. So not every case of sinusitis will require endoscopic sinus surgery. Definitely there are some indications. We will not subject all the patients of sinusitis for the endoscopic sinus surgery. There are few indications, and if the patient fits into that indication, we offer surgical.
And is this covered by the insurance?
Yeah, definitely.
Okay, fine. That is very important for us.
Yes.
So that was a wonderful session we had with Dr. Chandrakant Patil from Tumbai Hospital, Dubai. He told us a lot of things about sinus and sinusitis which we might not be aware of. So next week we are going to meet another doctor from the same hospital with another specialty. So stay tuned for the next segment where हम लोग अभी घरेलू नुस्खे पे जाएंगे. Yes, there are treatments which are going to be happening officially. There are treatments that are available right at our home, which is going to be very easy for us, instant remedies. So stay tuned because the third segment is going to be very interesting too.